Thank you. That's my disclosures. So as I'm sure you've heard, compressed sensing offers scan time reduction for improved clinical applicability, and this is particularly relevant for 4D flow imaging. And in fact, previous work by some of my co-authors demonstrated a 2-minute aorta imaging protocol using a Haar wavelet transform-based compressed sensing. It demonstrated peak velocity and flow quantification within 15% at an acceleration factor of 7.7. So the reason that we can't simply apply this to image the brain is because the requirements are substantially different. There are small vessels and a large field of view requiring a high spatial resolution. A large velocity dynamic range is required. One nice thing is that the motion due to respiration is actually less important. But one thing to consider is that the metrics of success for clinical applicability can be somewhat different. So in addition to the velocity and flow quantification accuracy, there are measures of internal consistency like flow conservation that can be important in the clinical context. So the sequence that we evaluated is a compressed sensing sequence that uses a spiral violet axis sampling pattern that is rebinned retrospectively using ECG gating into the cardiac phases, as you can see here. And the reconstruction is the solution of the reconstruction equation with the temporal regularization enforced by the red terms and the spatial regularization highlighted in green. Our in vitro setup was a silicone vascular model embedded in agarose to prevent motion, and we used a pulsatile blood pump to supply it with gadolinium-doped water. And we also tested this in one healthy control. So our in vitro tests were at 1.5 Tesla, and in vivo scanning was done at 3 Tesla. And in each case, we compared a compressed sensing sequence with an acceleration factor of 6.4 to a reference sequence with GRAPPA acceleration factor of 2. And what we varied in the compressed sensing sequence was a range of spatial resolutions and a range of what I'm going to call the temporal regularization factor, which is a ratio between the temporal and spatial regularization coefficient, and that sort of tells you the relative importance of the temporal versus the spatial regularization in the reconstruction equation. Our workflow included corrections for phase offset, velocity, aliasing, and noise. And you can see below the segmentation, centerline extraction, and placement of multiple planes across each vessel in the in vitro phantom and in the control. We used a number of metrics to evaluate what the optimal parameters should be. So we looked at time-integrated flow and peak velocity quantification accuracy using a Bland-Altman analysis. We looked at flow conservation. So over the entire circle of Willis, we compared inflow to outflow. We looked at time-resolved flow and peak velocity quantification, looking at the time-resolved waveforms of flow and peak velocity and taking the Kolmogorov-Smirnov distance between the reference and the compressed sensing. And finally, we looked at the ability of our segmentation to discriminate between velocity areas. So we looked at an ROI just inside and just outside the segmentation for individual planes and compared how different they were across the segmentation. So here are some representative pathline images. This is the reference scan of our in vitro setup, and this is the compressed sensing scan. And you can see that in the sample waveform, there is some underestimation of the peak flow in the reference shown in the compressed sensing shown in red compared to the reference in black. In vivo, the path lines for the reference look like this. And compressed sensing is visually similarly distributed, but the waveforms show some underestimation. And in the results that I'm going to show you, the color coding represents the temporal regularization ratio. So the lightest color is the most temporal regularization, and the darkest color is the least. The first thing we wanted to look at was the Bland-Altman analysis. So the flow underestimation is the Bland-Altman bias between the reference and the compressed sensing in vitro. And you can see that for the it's not what I wanted to do. You can see that for the lightest colors, the flow is initially underestimated. And then as you increase, at the lowest spatial regularization, as you increase spatial regularization, there is a maximum of flow, the least amount of underestimation. And then as you increase spatial regularization further, the measured flow decreases again compared to the reference. Now, with a lower amount of temporal regularization, that curve shifts to the right. So that means that with increasing spatial regularization, the optimal, or the sort of turnaround point happens at a lower temporal regularization. And we'll see that pattern again. So for example, in the Bland-Altman limits of agreement, which give us the flow reproducibility coefficient, if you look at the darkest points, they have a minimum at a region between 0.6 and 0.8 times 10 to the negative third spatial regularization. And what you see is that, again, as you increase the temporal regularization, so with the lighter points, that curve moves to the left, and also the limits of agreement become wider. And finally, for peak velocity underestimation, so again, the Bland-Altman bias for the peak velocity, we see that at low spatial regularization, there is an overestimation of peak velocity, most likely due to noise, and systematically, as we increase both spatial and temporal regularization, the underestimation increases. So overall, we can see that there's a trade-off between spatial and temporal regularization. So increasing temporal regularization decreases our tolerance for spatial regularization. And in each case, there's a trade-off as well between low regularization leading to noise and high regularization leading to smoothing. So those are the factors that we'll be considering moving forward. So for flow conservation, we see that the reference standard shown by the blue line in each plot is actually right above 0.9 or 90% flow conservation. And in the phantom, the compressed sensing actually performed better than the reference for flow conservation, probably due to some increased smoothing. And there was not a large effect of temporal regularization, but spatial regularization improved it further. However, in the control, increasing spatial regularization actually decreased the performance of the compressed sensing in flow conservation, and I think this is most likely because it disproportionately affects the smaller vessels, and there's a wider range of vessel sizes in vivo. When we compare the distance between flow waveforms, we see that, again, there's a slight, there's an optimal point at which the distance between the reference and the compressed sensing waveform is the lowest. It's right around 0.6 to 0.8 times 10 to the negative third, but it does move somewhat to the left for increasing temporal regularization. So again, the higher the temporal regularization, the lower the spatial regularization to reach that optimal point. We see that both in the phantom and in the control. We see a similar thing. It's a little bit more difficult to see for peak velocity, but the optimal or the lowest distance is again seen at an optimal point that is smaller spatial regularization for higher temporal regularization, and that curve shifts leftward with higher temporal regularization in both the phantom and the control. And finally, for the velocity discrimination of segmentation, so again, that SNR proxy measure, we see that in the phantom, there is not a substantial effect of temporal regularization, but in the control, the impact of both spatial and temporal regularization is quite high. So in conclusion, we find that compressed sensing with Haar wavelet regularization has potential for reasonable data quality for intracranial applications in a shorter scan time. But we also find that the optimal parameters for neurovascular imaging differ substantially from what we found in the aorta. And importantly, it's quite likely that the lowest temporal regularization ratio of 1 that we evaluated was actually higher than the optimal overall. So the, one of the future directions is to evaluate a lower temporal regularization that is actually less than the spatial regularization. And with the aim of further improving the performance, we'd like to further investigate higher acceleration factors, evaluate the potential for visualization of vascular lesions, such as the aneurysms that are present on our vascular model, and finally to expand our in vivo cohort of healthy controls and neurovascular disease patients. So watch this space, and thank you for listening.